Well, more than 100 Hoosiers are now getting their prescriptions hand-delivered as a result of a new partnership sparked by the pandemic. The idea came to life when Eskenazi Health in Indianapolis could no longer allow patients to come in person to its campus to pick up prescriptions. Business of Health reporter Kylie Valletta has more. Kylie.
Thank you, Gary. Eskenazi Health tapped local minority-owned Pillow Logistics to transform its traditional pharmacy operation to add home delivery. Indianapolis-based Pillow Logistics has provided round-the-clock on-demand delivery service to Eskenazi's medical clinics for about 15 years and was up to the challenge of launching home delivery when the pandemic gripped the state. Within days, Pillow Logistics was getting critical medications to patients at home, and the new service is now booming, making about 100 deliveries per day. Joining me to tell us more about the new service is Todd, the manager of outpatient pharmacy services at Eskenazi, and Eddie Pillow, the president of Pillow Logistics. Thank you both for being on the show today.
Thank you.
Thank you.
All right, Todd, let's start with you. Take us back to the early days of the pandemic when really this need to get your prescriptions to your patients overnight became a critical need overnight.
Well, if you'll recall, when the pandemic started, people were asked to shelter at home, businesses were closing, and other businesses were limiting the number of people to come in, trying to protect everyone. We still had patients that needed prescriptions, and we needed to figure out a way to get them delivered. And that's when we contacted Pillow.
All right, Eddie, I hear that you have now delivered prescriptions to more than 3,000 patients. Give us an overview of how this delivery service works.
Sure. So we've had the privilege really of being able to integrate our systems to allow the Eskenazi pharmacy team to place delivery orders directly into our portal. Orders are placed by the pharmacy daily and we deliver those same day. Our system then provides the pharmacy team real-time visibility into their patient delivery order status. And then on the back end, our delivery portal utilizes a geofencing technology that would prevent orders from being delivered to the wrong address. So definitely working on some making sure things stay within the HIPAA guidelines.
All right, so Todd, explain how this really helps your patient population at Eskenazi in particular and really removes some of the barriers for them.
Well, a lot of our patients do have barriers. Sometimes they're physical barriers, some are developmental barriers, some people have transportation barriers. With this service, Pillow delivers it to their hand each day, so we know at the end of the day that the patient has received the medication that they need.
And Eddie, you are the largest minority-owned courier service in Indiana. What does this kind of growth mean to you, especially during a time when a lot of small companies were not doing well at all?
Yeah, it's really been a blessing. It's given us the opportunity to provide more employment, more promotion, and even more service opportunities for underserved communities here in central Indiana, as well as it really kind of pushes forward some growth plans we had to increase our presence throughout the state. So we truly see it as a win-win.
And Todd, Eskenazi could have chosen a national logistics company or a larger company to execute this home delivery service. Why did you see such a good partner in Pillow Logistics?
Well, we were looking for more than a standard service where you dropped it in the mail and it might show up in a mailbox or show up on someone's door. With Pillow, it's delivered to the patient's hand so that we know that the patient receives the medication, we know when they receive it, and we know that it's been handled properly.
And Eddie, because of this new partnership, you've added a new segment to your company as well with Eskenazi involving warehousing. So explain how that came about and what you're doing for Eskenazi now because of that.
Sure. So Eskenazi has stayed ahead of the curve, ramping up on PPE materials. We've gotten into the warehouse and fulfillment business for them. So obviously, as they have looked down the road, looked at their needs, they've reached out to us to provide more of the warehousing and real-time, just-in-time delivery to their clinics and their hospital locations. It's been great.
And Todd, I imagine that you get to talk to patients as part of your job there. What are they saying about this new service? And are they even perhaps more compliant now with their medications, that it's being brought to them at home than they were even before the pandemic?
As I said, our patients face a lot of challenges, and they are absolutely thrilled that someone brings their medication to them when they need it. They don't have to worry about, is it in the mail? Did somebody steal it off of the porch? They really, really appreciate the excellent service that we've received from Pillow. We've received compliments on the drivers, how courteous and professional they are. It's just been a great relationship for everyone.
And Eddie, we just have a few seconds left, but your company before this had never done a home delivery service like this. I understand you had to add some new technology to make it happen, and I know you did it within about a week, which is pretty impressive. Just tell us what that whole experience was like.
Yeah, I mean, anytime you talk about delivering something as sensitive as medication for pharmacies, obviously you want to make sure that you have all the accuracy there. So again, the geofencing to make sure that the driver was only able to close out the runs at the proper location. So it's upped our game for sure, and we definitely appreciate being able to provide the service for Eskenazi. It's been a great relationship.
All right, well, Todd and Eddie, thank you both for being on the show today. No doubt this will probably open some even more doors for both Eskenazi and Pillow Logistics. So thanks again for being here today.
Thank you.
Thank you.
And Gary, back to you.